Are you or someone you know currently in the military? Do you know anyone who has been in the military in the past? Are you a veteran? Well, this presentation is for you. Hello, my name is Princess Sanders, and I am an LPN to RN BSN student at Indiana State University. Today I will be speaking about military sexual misconduct. This is for the population at risk, current and previous service men and women of the military. The learning objectives for this presentation are the following. The viewer will identify the difference between sexual harassment and sexual assault according to the U.S. Department of Defense or DoD. The viewer will recognize the processes for determining the occurrence of sexual misconduct. The viewer will categorize processes and terminologies that belong to the U.S. Department of Veteran Affairs or VA and the DoD. The viewer will describe the symptoms of military sexual trauma or MST. The viewer will list disclosure barriers for MST, and the viewer will list treatment options for MST. Please take this time to take the pretest to test your knowledge about military sexual misconduct. According to the U.S. Department of Defense, sexual harassment is defined as unwarranted sexual advances during training or active duty. This can lead to an uncomfortable disposition of the prospective or actual service member by another prospective or actual service member. Also, sexual assault is defined as sexual contact that includes force coupled with the lack of occurrence or inability for the victim to consent. However, according to the U.S. Department of Veteran Affairs, both sexual harassment and sexual assault equals military sexual trauma. 25% of female veterans report MST occurrence, while 1% of male veterans report MST occurrence. Again, military sexual trauma defines both sexual harassment and sexual assault according to the VA. So, how is military sexual misconduct determined? Well, according to the VA, MST process of determination goes something like this. All patients presenting to a VA treatment facility are screened for MST upon initial visit. As well, the process is formulated from historical recollection. Also, it is intended for all veterans seeking current health care treatment. In addition, the Department of Defense determines sexual harassment and or sexual assault in this manner. It is intended for active duty service members. Periodically, a survey is presented to service members to determine the prevalence of sexual harassment and or sexual assault. This is with emphasis on intervening during sexual harassment. The Department of Defense considers sexual harassment as a first step to sexual assault. So, what they want to do is intervene during sexual harassment to prevent sexual assault. According to the VA, there are some identifiable symptoms that occur with MST. That includes mental disorders such as PTSD, post traumatic stress disorder, also abnormal relationships and social interactions, a decline in physical health, as well as Drug and alcohol abuse. There are many reasons that one would believe barriers occur with the disclosure of MST. Some of those barriers, according to the VA, are the following: a stigma, the negative connotation that accompanies being transparent about what occurs while serving time in the military. Also, discomfort associated with the disclosure to a healthcare provider. We want to make sure that the patient is comfortable with discussing personal life events with the healthcare provider. Also, the lack of desire to discuss past misconduct. Sometimes people want to leave the past in the past. And also the fear of betrayal if the MST occurred within the victim's unit. The military is about deep camaraderie, and for that reason, oftentimes veterans and current military service members do not believe in turning their back on their fellow service members. For that reason, disclosing what occurred within a unit often feels like betrayal. So, what are some treatment options for MST? Well, according to the VA, we should speak to an MST coordinator. Also, joining a support group is truly helpful. The veteran must be aware of triggers and reactions. A focus should be on the veteran's emotional health. The veteran should also keep an open mind and remain positive. This concludes this presentation about military sexual misconduct. Please take a moment to review the references that help to make this presentation come to fruition. Also, take the opportunity to take the post test to see how much you've learned that you did not know before. This public service announcement is intended for those in the military, who were in the military, or have friends and family associated with the military. Hopefully, you have learned something today and are in this quest to spread the word about military sexual misconduct. Thank you so much for your time, and I hope you have a wonderful day. And remember to thank an active service member or veteran for their services. They are important to each and every one of us.